For 22 years, my conversation with women about hormone replacement therapy has been muted. We've had this conversation behind a closed exam room door, and I've had the cloak and dagger game going on for 22 years, where I'd tell patients, do not repeat this to your insurance company. Do not be talking about this with your friends, because I don't need any more women referred to me for this conversation that is against the warning found on the packaging. And for the first time in 2 decades, this conversation has been liberated. We get to talk about it. Every woman should be thanking RFK and my friend and colleague, Dr. Marty Makary, the head of the FDA, because they have removed the black box warning on hormone replacement therapy for women in menopause. We're going to cover the highlights. We're going to talk about some of the naysayers and what they're saying about menopause and divorce, menopause and longevity, and why the conversation is anew and you should be taking it to your primary care. Thanks for joining me tonight. We are Tuesday night here in Tampa Bay. I am super excited about the week that is here and the one that is coming your way. We have an exciting event here in Tampa. Hack Your Health it has a new home this year. Instead of Austin, Texas, they have landed in Tampa, and that event starts Friday, Saturday, Sunday. If you're in the Tampa area, by golly, come show everybody how great our city is. If you're not from here and you're coming, we can't wait to welcome you, and I will be there all 3 days with a lecture on Sunday morning. Thank you for all of the folks who've supported that organization. If you're new to my channel, you'll know that I've gone to this, or I think it's my 6th year of attending this, and I just love it. It's one of my favorite conferences of the year. Let's get started with this lecture tonight. In the chat tonight, I would love the women, and I know this is a conversation that is focused on hormone replacement therapy, but all you men, I would have you double click and listen in that this is a really powerful conversation that has not been easy to keep under the hood. I have a few friends and colleagues across the country where as soon as the announcement came out yesterday that RFK and Marty Makary had a press release saying, yes, after much consideration and much discussions from experts across the industry, we are taking away that boxed warning on hormone replacement therapy. And we're going to talk about why we're doing that tonight and why I think everybody should be paying attention to this. Not just because I turn 54 at the end of this month, and menopause is something I've been talking to women about for 20 plus years. And now it's about the season for me to be enduring that. All right, let's go over to the slides. We're going to go through the what, why, and how, what we're talking about here. For starters, the FDA did make this announcement. They are removing the boxed warning. This is, again, something if you've ever had, for the clinicians that are listening in, for the providers, and you find how much fear goes through a patient when you prescribe something, knowing it's going to help them, only to get that call back to your nurse or your medical team that, well, what about all these warnings that are on the Federal Drug Administration's words of advice? And it is a little comical. You're like, oh, no, you should listen to them, but not in this case. They don't have all the facts in this case. And of course, that just sounds ridiculous. But the number of times that I've had patients call in saying, this says that I shouldn't take this, that it's going to increase my risk of heart disease. It's going to increase my risk of cancer. Are you sure I should be taking this? And I'm like, oh my goodness, yes. So in the comments, I would love to hear if you had ever had this conversation with your doctor. Say yes or no that you've had the conversation. And then the second follow-up is yes or no that you have been prescribed postmenopausal hormone replacement therapy. All right, a couple other things. The black box was there. It started in 2002 findings, but it was added to the label in 2003. It did have the words cancer. It did have the correct words blood clots. That the HRT prescriptions over the next 3 years. And I remember this so vividly because I was a brand new physician, a year into practice when this was starting, and the prescriptions dropped by 70%. All of my colleagues sent the girl patients to me if they were going through menopause. I don't know why. I was going to be more equipped at dealing with this than them, but it just somehow, that's what happened. And here I was, patient after patient after patient going, I don't know, everything I learned got turned on its head, and I don't know how to explain this. I have been on that front row seat, walking women through menopause, trying to do what the federal government was telling physicians they should do, and then trying to stay out of the outlier danger red flag zone for this prescriber writes a lot of prescriptions for estrogen and progesterone in these menopausal women's. I think somebody should talk to her about her prescribing habits. Yes, that's what happens when you're an outlier. The FDA now says that the evidence for using hormone replacement therapy shows benefit that outweigh the risk for many women under the age of 60. We're going to talk about that nuance and how I am talking my patients through that. The new guidance says starting HRT within 10 years of menopause or by the age of 60 is now recommended. Wow, is that a difference? That gives me goosebumps. That is so much better than what we've had. The history lesson is something many of you know. The WHI did have this large randomized controlled trial. Again, that's supposed to be the gold standard. The average age of the participant was 63. Again, that's 10 years after most women go through menopause. And they found this slight increase in breast cancer, especially when they were specifically when they were taking the combination of Premarin and progesterone, and they found this slight increased risk in strokes in those patients. That the black box, which was in 2003, listed the risk for heart disease was going to be higher, the strokes were going to be higher, and they even added the word dementia. So you can imagine that when patients are saying, you know what, I don't feel well, I know there's something happening, and if you watched this channel before, I've gone through some really fun history lessons on why this is such a strange thing that we don't have more information on, and all of that tide is changing, which is how this warning got removed. But we also have really important information about what happens to a woman's brain when she goes through menopause, and there is no more estrogen and progesterone in her system. Now, as a physician, I can tell you, this was real. I could see this happening in patients. I know that it's been 6 months since your last prescription. I know that you are having little bit, you're taking your pill, you're breaking it into half and quarters in hopes that you don't run out. I mean, they were siphoning their own prescription, knowing that I was trying to stop these prescriptions like everybody had advised physicians to. And these women in their 50s were saying, but when I go off of it, something terrifically different is happening in my brain. And, you know, when one patient says it, you're like, I don't have any experience with that. I don't know that. When you get 6 months into this change of prescribing habits, again, 70% of all the women across the country stopped their hormone replacement therapy. They went through a massive and quick removal of those hormones. And I'm on the front line saying, there's something to this, you guys. Every single one of the patients talks about how they can't sleep right. The depression is worse. They can't seem to multitask. And I know men think that's not possible, but women have this thing where they can assess or at least remember the things that they need to keep track of by the end of the day. And when that prescription stopped, they're like, I can't do my job anymore. I'm bursting into tears. I've never done that. I'm pretty sure this is from the hormone. I stole some of the Prempro from my sister and took it. And I felt better for like 4 weeks, but now it's gone. So they go on it, they go off of it. I'm like, that's a pretty compelling story. I'm hearing you. I don't know what to do with the difference between what the federal government is telling me to do with these patients versus what was actually happening in my practice. And so what started to unfold was, I don't know how to explain this. I just think there's more to this. And again, when you dive into the literature, you're going to see in a minute here that what the federal government was saying was not what I was finding and what I was also seeing in these patients. So yeah, the history lesson gets worse. That WHI trial, women were older than typical HRT starters, again, 10 years older. And they were using this, what I had only known, it's the only prescription I'd ever prescribed was Prem Pro. And they think that that combination specifically, which is conjugated equine estrogen, so that's a horse's urine, a pregnant mare's urine, which is where Premarin comes from, and then medroxyprogesterone acetate, which is a form of progestin that is a precursor. So estrogen alone showed no increase in breast cancer and actually maybe a slight decrease when they were in their 50s. The HRT effects differed if they started early versus started late. But I'm telling you, the differences between these populations was so tiny. It was so tiny, but it was measurable. It was measurable, and it's a randomized controlled trial, so that's supposed to be worthy of listening to. And many times you've heard me say this before, that when they put these guidelines out for the WHI trial, the statisticians were asked to be removed from the room because they just needed to make a decision. Yeah, I'm going to say that again. They took the math people away and said, nope, this is such an expensive trial. We just have to come up with clear guidelines. They sent the mathematicians, the statisticians out of the room. The experts decided this is the message we're going to send to people, despite not having the evidence for it. And of course, we don't get to hear that for another decade. I can't understand how these experts, I mean, could they possibly have missed that they haven't talked to women as they were coming off of it and then living in the aftermath of that hormone replacement therapy being slammed away from their body? Early menopause hormone replacement therapy may prevent issues like late starting it, which when the arteries were starting to harden or stiffen, it may not help them and it could harm them. And I must have said that at least 1,000 times to patients. Many doctors became extremely cautious. And again, I'm pretty sure that's why all of my male colleagues said, why don't you go down to Dr. Bosworth and have her talk about this? She's got a lot of patients she's working with this on, because it was said, only prescribe this in the lowest amount for the shortest amount of time. I had, pre-written text that said, yeah, guess what? We should be using this for the lowest amount of a dose for the shortest amount of time. And I sent it out on almost every letter that we talked about. So here's what we know now. We know that women that are less than 60 years old, if they start the hormone replacement therapy, are not in a higher mortality than those that are on it. Some analysis show the mortality is reduced. And this is where the headline from Mother Jones was really fact-checking Dr. McCary, when he said, yeah, we think that it has increased mortality by not having this prescription available to these women, by not treating some of the things that are preventable, and especially when it comes to fractures of the bones. Hormone replacement therapy within 10 years has a 30 to 50% fewer heart events. That's cardiovascular events. There are 50 to 60% reduction in the fractures. That's so big. I mean, and they've had a fracture in those 70s or 80s. They never return to baseline. They never get back to their full function. And to know that that's preventable with hormone replacement therapy, there is nothing that preserves the bones better in a woman than hormone replacement therapy. And then, of course, the cognitive benefits I talked about just a minute ago. That modern hormone replacement therapy versus the old stuff said, yes, right now we say estradiol and micronized progesterone appears to be safer than the previous formula. This meant that there were less breast cancers, or at least less of a signal for breast cancers, and that the transdermal estrogen does have less of the stimulus for promoting blood clots. So here's some supporters. You might guess that the American College of, let me move my head there. American College of Obstetricians and Gynecologists said, yeah, this is long overdue. removing that black box warning, especially the low dose vaginal estrogen, was also, every time he wrote a prescription for this, this came out of the pharmacy's printout as well. It's been scaring patients where they had harm to patients because of the fear. I 100% agree with that. I saw that in real time. The Menopause Society, called NAMS, they also said the most effective treatment for hot flashes has been estrogen therapy, and women less than 60 with no contraindications, the benefit risk ratio is favorable, and they are so happy for this removal, as am I. The Endocrine Society, again, these people do not weigh in, they do not chirp about this hardly at all, but even the Endocrine Society came forward and said, praise God, the transdermal estrogen and the appropriate progestins are absolutely what we are saying. Now, there was a tweet from the World Health Organization saying, at last, the science wins. Women can get menopausal relief without this fear. And I'll tell you, that is probably the hardest part for me to have talked about over the last couple of decades was, you know, when a patient comes to you and wants your advice, and then I've been through this scene. I've seen what happens if you stop this hormone replacement therapy, or what happens in their cognitive performance over the next 3 years in that perimenopausal, where hormones are doing this nasty thing. And we teach metabolic health on this channel. I mean, I know that when they would cut the carbs, decrease the insulin, be in a ketogenic state, much more graceful of a process for going through this. But what was not ever said was, she still should have the estrogen and the progestin, especially in this perimenopausal place where a gradual reduction in the amount of hormone. And, you know, personally, as I now confront with my doctor, what do I think the right plan is? Well, for sure, I'm not going to wait till menopause. I'm not going to wait till 12 months since the last period before I start hormone replacement therapy. It should be started in that perimenopausal place, because it is that fluctuations up and down, that sputtering of what happens to the production of estrogen and progestin as a woman goes through that perimenopausal phase. That's the most symptomatic. That's where people say, oh my goodness, I am the crabbiest version of myself I've seen in years. And it's real. It's not just like, oh, they're having a bad day. You know, it's like a 12-year-old getting the period for the first time. No, I am a mature woman. I get how to control my irritability. This is beyond measure. I haven't seen this in my lifetime. And you would hear women say the exact same thing over and over and over again. You know, going through this, and of course, watching it as a young woman, I kept thinking, honey, I never want to go through this. I would, you know, go home to my husband saying, these women are a little off their rockers. I never want to go through menopause. It looks horrible. And of course it's not. I don't want that to be the message you hear, but those symptoms were just profound. And, you know, I was talking to a colleague, Barbara Levy, and if you know her, Google her name. She's, you know, one of the experts across the seasons, and how much, you know, we were like the speakeasies of our regions, that she would be telling other physicians, well, here's what I'm doing, but it's not written in any guidelines anywhere. It's not something I can talk about. And I said, oh my gosh, that's what I did in the Midwest. I mean, in the, you know, South Dakotas where I was during those years, and said, no, here's what I do. Here's how I tell the woman. Here's what I'm using to get to check, you know, are we in the right place? And, you know, of course, you know, 20 years of doing that over and over again really did teach me that there is a system to this. It is very predictable. Now that I'm the woman that will be going through it, I am definitely not allowing perimenopause to happen without coverage of that. And it is just so nice to have the removal of this warning. Here's some, the critics. The critics were what I wanted to just roar when I read some of this. So the New York Times put out an article, and Dr. Zuckerman said, removing that black box is taking women's health backwards. That claim of HRT is the best way to improve women's health is inconsistent with years of research. And I just want to tell this lady, come sit by me. Come sit by me and watch what it is that I see, and how that, you know, it really isn't true. The FDA there was a warning that came with that, saying, yes, the FDA did say this, Dr. McCary did say this, that they are having an outside advisory committee review what they're about to say before that official label change was happening, and that they haven't gotten back to them on what their guidelines were. That was their argument. Mother Jones, and if you've ever read that magazine, you know they love to fight, but they said, we found no evidence for some of these dramatic claims. And their dramatic claims were that menopause, some of the things that the news press said is menopause causes divorce and it shortens their lifespan. And they said that's just false. They cautioned that menopause is a natural phase and not a killer. And I just want you to come sit in the seat that I was in. I think some of those women might have threatened my life had I not given them their estrogen during the times they were so symptomatic. They think it's oversold as a cure-all. I think the critics just are too far removed from the reality of what this looks like. And I think the conversation that should be had, not just behind exam room doors, but it's been in the practice. And when physicians, like Barbara Levy and myself say, here's what I did, what did you do? And we ended up at the same place saying, no, that's how the process that I've done, that's what I've looked at. There are some warnings about how long can we write this. And we're going to get to those answers in just a minute. I want to take on some of these really, they can sound outlandish. Does menopause ruin marriages? Well, there's a survey done in the UK over the last couple of years that 7 of 10 women blame menopause for their divorce. Now, there's going to be a skew to this because they were asking divorced women. So they weren't asking all women. They were just asking the divorced women, did menopause play a part? And indeed, they said, yes, it did 7 out of 10 times. That the severe menopausal symptoms include things like that mood swing, the no sleeping, and the decreased sex drive. And of course, that can strain a relationship, but menopause itself probably isn't, all of the answer. I tell patients, yes, this is a time where your relationship probably needs some nurturing. There are treatments, whether you choose to use medications inside the hormone replacement therapy umbrella or outside of that really do help relieve those symptoms. It's recognizing that you're not making this up. It's not fake news. It really is. Then the other major claim that was out there is, and this was in the press release where Dr. McCary says, yeah, the mortality, there have been premature deaths because of this boxed warning on hormone replacement therapy. I totally agree with him. The evidence is on all-cause mortality. The World Health Organization, that study from 2003, shows that HRT does not increase the risk of death. Okay, so there's the first thing that they have now been able to just say the quiet part out loud. It does not increase your death to take hormone replacement therapy, period. That some of the data even suggests that starting in the mid-50s might reduce that risk. And of course, that's the part where, who's coming into me? They're not the 70-year-old women who've been off hormones for 20 years. They are the women going through the withdrawal symptoms of what menopause, yes, a natural part of the aging of a woman. That transition can be incredibly symptomatic for some women, though. Preventing heart disease and fractures, I've already covered that. That's the major win. It's not a fountain of youth. I agree with that. But it does have health benefits that translate through the longevity. On this channel, we talk about how is it that I think you should be aging in the most graceful way. And of course, I think you should be producing ketones 2 to 3 times, at least 2 to 3 sessions a week to get that, fountain of youth. That's really where I think the fountain of youth is. But do I think you should be doing it in the absence of hormone replacement therapy if you're perimenopausal? Heavens no. So the FDA explicitly noted there is no increased risk from cancer deaths and a possible mortality reduction when you start them before the age of 60. This is why you see all the guidelines written so specifically that we want a clear message that says, yeah, we know we told you this was going to cause cancer, and now we're telling you if you start it right around perimenopause, it might prevent cancer. It might improve that cognitive deficits. So menopause itself doesn't kill, but HRT isn't about cheating death. It is about improving the quality of life and really using that lowered risks of death conditions like the fragility of their bones and I like to think of the pliability of those heart disease. So we have some questions that are coming in here. I'm going to go through some questions that I put together in just a second. I want to give you a chance to type in those questions. My team is looking at that and we'll put those over to the side. I know there's a lot of people out there that have written in. We tried to put the emails all about hormone replacement therapy in a special like folder saying, how often do people write in about this? And it's a lot. It is a lot. So I'm going to try to cover the ones I think are going to be the most poignant questions first, and then we will share your questions here in just a minute. I do want to say a couple things. So here is, again, Dr. Ba's website here, and you can see this little part, Dr. Ba's favorites. You can see my little cursor there. Under the Dr. Ba's favorites, this is Hack Your Health. So if you haven't signed up, again, at the Pin Chasers today, I was really a big cheerleader for our hometown of Tampa we have a bunch of folks coming into town for this. And I have a lot of colleagues that do not realize that this is happening in our town. So again, Hack Your Health coming your way. A few other things that I have put on my to-do list. One of them is there is a carb sober cruise that's leaving actually on Monday. So if you're doing that with me, I can't wait to see you Monday. We will be in the Caribbean here in Tampa Bay area, leaving from the Tampa Bay area and then heading to the Caribbean. Looking forward to meeting all of you on that cruise. I haven't talked about that much recently, and a couple folks said, "Are you doing that?" The other part that I wanted to point out on our website is I get a lot, I talk about this a lot at the Pin Chasers. What is it that I recommend or that I'm reading recently? And putting the Dr. Ba's book club in there, that's been something we've been working on. If you've never clicked on it, it's just a bunch of the books that I've recently been reading, recently been sharing with friends and family. I have a couple of business books that I had over the course of the last probably 6 months that we'll be adding to there in the next couple of weeks. All right, back to our final thing on the questions, because I think this is where most of you are going to be a lot more satisfied with what is it that these guidelines are really saying. So first of all, is HRT now recommended for all women at menopause? So if you had asked me this behind in the speakeasy moment where I'm behind the exam room door, I get a skewed population. I get the women who are coming to me with problems. And then, in the world of women without hormone replacement therapy, it's been 20 years of watching some women gracefully age through menopause. Some women have the consequences of not having hormone replacement therapy on, but not chirping at me that they needed it. And they did have consequences that I think were preventable. So the answer here that I put in my list was, no, it's not a universal recommendation. Hormone replacement therapy is an option. I want to put a nice little arrow there, an option for women, and especially if they're having moderate to severe symptoms. If the symptoms were minimal, they do not need to do that. Now, if my sister, who's about 3 to 4 years younger than me, is about to hit menopause, I'm going to tell her, here's what I've seen happen with women over the last 20 years. They just have a much more graceful journey through this when they were on the hormone replacement therapy. And in the past, I've been able to tell my sister that, but I would not be able to say that on this YouTube channel to an audience of women who are saying, I know your mother didn't do this. And when women make decisions about having babies and breastfeeding and hormone replacement therapy, they look to the generation older than them saying, what did you do? And they listen. They take the wisdom of that older woman saying, how did it work for you? And if you had the benefit of a graceful transition, or if your relatives had the benefit of a graceful transition, they didn't have the conversation with their doctor. I personally would say, get a bone density. You lose a third of that bone density in the first 5 years without hormone replacement therapy. Don't do that. Do not do that to your bones. So the next question I put out there was, if I start hormone replacement therapy at 50, do I have to stop at 60? Now, we've known this change of recommendation was coming our way. I didn't think they would get to remove the warning this side of this year. Ooh, let's get my head out of the way. So this is something that I've already had to answer this question about 100 times just in the year of 2025. So when I look at, do you have to stop at 60? No. The mantra used to be shortest duration possible, which often meant if I was prescribing that hormone replacement therapy for someone for 5 years, there would start to be these automatic letters to me from the prescription provider, which was either their insurance provider or in Medicare, Medicaid, that would be the state, saying, you've had this patient on there for 5 years. Are you tapering them? Are you using this as the lowest effective dose? And you get one letter, no problem. When you wrote it as much as I did, I would have 100 letters a week coming in saying, hey, your lady's still on hormone replacement therapy. It's more than 5 years. And I'm telling you, that affects you. It affects the prescriber saying, good Lord, am I the only one out there doing it? And because of this warning, it was not allowed to be talked about. It wasn't at the conferences. You couldn't get continued medical education on it because it's against the rules. You can't talk about it. Yeah. Anyway, the new approach is that there is no hard cutoff at 60. There's no arbitrary stop date. It is individualized. So ask me in 10 years how I'll be doing it. No, that's not fair to say that. When I look at the women who have been on it for, I've got a woman she's in her 80s. She's still on her hormone replacement therapy and she's doing fine. And her bones, yeah, they look sexy for an 80-year-old. So I can't argue with that. Again, that's individualized for that woman. Can HRT prevent Alzheimer's? Again, we said that it increased your risk of dementia when we put the warning label out there. So this is really intriguing to think about. And as I look at some of that literature that is coming out over the next, it'll be coming out over the next, not just decade, but the major announcement that happened not 3 months ago, but 18 months ago was, oh my gosh, we can see a woman's brain now because we have a tracer that in a human female crosses the blood-brain barrier and looks for estrogen receptors in the brain. Before this moment, the mantra that I was told is that as you age through menopause, the number of receptors in your brain will slowly have an attrition. They'll slowly go away. And the truth is, that's not what we see. We see that the number of receptors in your brain goes up. And they're hungry for estrogen. They want to bind to estrogen. They really hold on to that little morsel of a hormone. And we can see it on these scans. We have a tracer. We can watch that estrogen get through the blood-brain barrier and really lock into some of that very primitive parts of the brain. We know that there are, I'm going to read this because I think it's really important that you guys see this as I talk about it. Go back to here. Some of the research suggests women who start HRT around menopause have a lower incidence of Alzheimer's and cognitive decline. And one of the resources was 64% reduction in the cognitive decline. This was in people who started it right after menopause, and then you measured them years later. But it was not a randomized controlled trial. This is always the argument that we'd have if you would try to bring this up in any kind of can we have some CME about what other people are doing with hormone replacement therapy in their practices? And they're like, no, we have the best study. We have a randomized controlled trial that says their cognition is getting worse. And I'm like, that is not what I'm seeing. That is not what I'm seeing. And does anybody else see this differently? They would fight back with, we have a randomized control trial that says it got worse, period, end of discussion. The WHI trial actually found that starting HRT at the age of 65 slightly increased the risk of dementia cases. And this is where they would fight you and say, see, we have the answer. It's a randomized controlled trial. See, here's the answer. The timing we know is critical. I know this makes it a really difficult thing to hear if you're in your 70s and now we're saying, oh, guess what? We were wrong. What we told you before is now the opposite. God bless you. The FDA removed the dementia warning, okay? They removed the dementia warning. That's what just happened yesterday because it doesn't apply to the typical user early in the process. Some experts are hopeful. When I look at some of the literature that I talk about, again, brains are what we study here at the Meaningful Medicine Clinic, and I think one of the most hopeful things over the next decade will be the use of these incretins, which would be Ozempic or Zepbound, the GLP-1s, the GIPs, and praise God for what will be coming in the next generation of these, which will be a triple agonist hormone, because of what it's doing for the rate at which we can remove trash from a brain that is aging faster than it shouldn't. I think that's going to be a game changer. Do I think that estrogen's the only way you can get that brain to be as perfect, as age as gracefully as possible? No. Do I think it's a really powerful signal for the women who have stayed on it through that perimenopausal and into their 60s and even 70s? I'm hopeful that that's what my sister and I are going to get to do. I'm hopeful that that's what our brains and bodies can tolerate, and that we keep our metabolic health strong enough that our estrogen that we take gets to our brain. Here, it's a few more slides before I go to your questions. Hang tight. I think you'll want to know what we don't know in the answers is long-term HRT beyond 65. You can see me being hesitant about what I'm telling you, what I think I'm going to do, because we don't have the answers there. We know that the lack of randomized trials are what gets us in trouble. So we lack randomized trial for people who continued it well into their 60s and 70s and beyond. The WHI trial stopped it at 70 for most. And this is where there's, some people do fine and stayed on it. And I have people in my practice who did that. The real question, is it safe to stay on for 15 to 20 years? And we don't have the evidence for that. We don't know that answer. Again, that's where clinical practice is supposed to win out, but clinical practice hasn't been something we could talk about in the recent past. All right, so I'm going to go to your questions here and just say, I do really appreciate how frustrating it has had to have been for the women who just have been in the season of life where we took it away, we scared the tar out of you, and now, praise God, we are able to talk about it. There will be continued medical education for doctors. That's the number one thing that's going to happen going forward. But more importantly, those of us that have been in the speakeasy estrogen club can now talk about, well, here's what I've done in my practice. Here's how I have taught other physicians to approach it and trying to navigate it. When I look at, I have patients who said, Doc, I haven't been on estrogen for 15 years. Will you start it on me? And I do think that's the right answer for them. But the first questions we had to ask were all about their metabolic health, their cholesterol and risk factors for inflammatory problems that would make heart disease, that would harden their arteries, that would make their brains not work well. I bet those are going to be in some of the questions you're going to ask me. Let's go to those. Okay, here we are. So looking, here we go. Driving a little, see if I can slightly, oopsie, don't do that. Hold on. Just let me fix that. Okay, and again. Okay, so here we have, is it possible for my body, I'm over 66, to naturally create sex hormones with high fat, low carb diet? Yes. So what they're asking is, okay, so in your ketogenic state, I feel really good. I have lots of women who have said, yeah, my sex drive came back when I really got into a ketogenic state, stayed there for about 4 to 5 weeks. And I wonder, is it placebo? Why do I feel so good? Yeah, you make estrogen from cholesterol, from fat. And that script, the way you make that hormone is actually in the DNA of several of the cells in your body. One of the cells is in your brain, that it will take cholesterol, and they say, the Latin word is de novo. From the cholesterol, from the string of fat, it makes estrone, which is the precursor to estradiol. It makes it right there in your brain. You didn't need an ovary to do it. It cannot do that when the insulin was high. It cannot do that when the movement of fat was under the super dictatorship of too much insulin. They were insulin resistant. They'd been overweight for a while. Their body hadn't seen a ketone in forever, because you see a ketone when the insulin goes down. And the only way that you could liberate the movement of fat and the de novo production of these hormones was to routinely visit a ketogenic state. And so I think I feel pretty confident in the intervals that I see, excuse me, that return of a sex drive is they are 4 to 5 weeks into a solid routine production of a ketogenic state. Like they aren't just like flashing 1 week and then 2 weeks later they say do it again. No, they routinely make ketones, first thing in the morning, and that sex drive is 4 to 5 weeks from kind of resurrecting. That's when I see it. Great question, actually. Let's go back to that and say, all right, the MTGC says, yes, but I was a smoker. I had a full hysterectomy 8 years ago. I did stop smoking. Praise God. That's one of the most important parts that you could do for longevity was stop smoking. Can I start HRT now? Okay, so again, this is not medical advice. This is educational purposes only. My lawyer will be really happy hearing me say that. So let's just talk about that. First of all, you took away one of the biggest risk factors for heart disease. You took away cigarette smoking. Again, I'm not saying take away nicotine. That's a whole different discussion. I'm saying that tobacco, especially in the form of the inhaled version, tobacco in any form, but the inhaled version is the most dramatic in stimulating heart disease, and you took that away. I did stop smoking at 61. Can I start HRT now? So the question would be, you haven't had a uterus for 8 years. I don't know how long ago how long ago 61 years was, but let's just say it was only 5 years ago. You're 66, like the last question. I would be looking at heart disease for that patient. I would look at what are the other ways we can measure what is your risk for heart disease. And that is starting with what's your blood pressure? What is your body mass? Are you overweight? Are you underweight? Are you in the right weight? What are some of the markers for inflammatory risks? And my favorite one to measure is something called an LPIR score. That's lipoprotein insulin resistance score. You can only do that. You can only get that from a specialized cholesterol test called NMR. I've got a bunch of videos on that. You can Google Dr. Boz and NMR and you'll find it. So what I'm doing there though is I'm walking through a risk profile for when you add estrogen. We do worry that you're going to have an increased amount of clotting processes, an increased amount of proteins. Now it's very slight when we're using the estrogens that are transdermal or that are sublingual or through the patches, meaning you don't swallow the estrogen. It comes into your body through a skin layer. My favorite way to do that is sublingual. I think it's the cheapest, easiest, most effective. But you can also get it from a patch. You can get it from a vaginal estrogen ring, absorb it through that vaginal wall. All of those are much safer ways for that estrogen to be added into that woman, and we are having the lowest amount of risk factors for the blood clot, for the cardiovascular event. But as I walk women through this, and if they come in with an elevated hemoglobin A1C, meaning their average blood sugar is through the roof, well, I'll tell you that their LPIR score is not pretty at the time. It doesn't have to be perfect to start estrogen. In my clinic, I look for LPIR scores at least below 40. I love it if they're less than 25, but if they're coming down and they're under 40, I have a conversation saying, if you can get it down a little bit further, it's a lesser risk. But I find their metabolism and their energy and their brains are so much more resilient when we add estrogen back that it's almost like punishing them. Like, hey, I know that your body's going to work better with a little estrogen, and your metabolic health is in the toilet. You've been disciplining yourself back into a ketogenic state and doing all the things that we ask about, but I need you to be perfect before I put that estrogen on. That's not how I do it. But I do show them this is a risk. It's going to be less of a risk if you've got a healthy blood sugar, you've got the body weight that's not excessive, and you don't have high blood pressure. All of those are important. So again, what you heard me say there is, in my practice, I walk through that very specifically, looking at their cardiovascular risk and then saying, all right, and the hardest part is the first year. After the first year, you get to say, no, we're continuing hormone replacement therapy. It is in that first year that they have the increased risk of cardiovascular events if they've got those really stiff, hardened arteries. So really great question. I get that actually a lot. Okay, let's go to the next one. Let's see, it's Deborah who says, how long can a woman be on HRT? Well, that's a great question. I had that in my list too. I don't know if I put that on the slides just a minute ago, that you don't have to stop it. The 10-year mark is not the, oh, you can be on it for 10 years and then we have to taper you. It is individualized risk, and I'm so thankful that they removed that. Yeah, you and many other people were going to ask that question. All right. eBay One Queen says, how do you feel about compounded biest cream, progesterone and testosterone cypionate? Okay, so the biest is it is two types of estrogen. I'm pretty sure this is what that compounding, I think, means the same thing as it's got a E2, meaning it's a, so I see if I can talk chemistry with you guys. So you've got three versions of estrogen. You've got estradiol. You hear the D in there. That's an E2. You have what's the third one called? Estradiol. Estrone is one. E2 is estradiol, and then there's an E3. Like estriol, I can't remember. It's got a Latin word 3 in there. So the biest has two of those estrogens combined, and I've looked at the literature on that, saying, did it help them with a decreased amount of risk for breast cancer? And I just don't think that's. I mean, it's really expensive. I haven't been a big fan of it. I don't have any patients on it. I have them on the estradiol sublingually. The progesterone, I do think the micronized progesterone is a far superior product than the MPA, the medroxyprogesterone acetate that was used in the trials for the WHI trial. The testosterone I've used from time to time. I think the topical testosterone that was designed for men. Men would put one of those little 5-gram tubes on their chest every day. And women, I tell them that tube should last about a week. You're going to want to put it on a place where you don't mind hair growing. So most women say that's their legs, and they'll shave their legs. The side effect of testosterone on a woman topically is it will stimulate those hair follicles to have dark black hair. When a man puts it on his chest, he doesn't care. It's like, very manly. But when a woman has chest hairs coming out in the black version, they say, what are you doing to me? No. So they put it on their legs. So I have women that do that, but most of the women, and again, this is a generalization that speakeasy moment over the last 10 years, when their metabolic health was healthy, when their A1C was less than 5.5, when they had decreased amounts of insulin because they are on a low carb, high fat, ketogenic diet, when the volume of food is respecting that they're hitting their body mass and staying at it. They're not no longer in a catabolic, they're not losing weight, they are in that level. I find the woman's testosterone goes back to normal. I mean, women have 10 times more testosterone in their body than they do estrogen. Look carefully at the units when you're looking at testosterone and you're looking at estrogen. Testosterone is 10 times as high in a woman than her estrogen is. I mean, a man's testosterone is even way higher than that, right? But in a woman, you have more testosterone than estrogen. You get that testosterone from the estrogen, and your body will. So when their metabolism, again, what's happening here? You're converting fat from one area of a fatty hormone from this, and then you're looking at an enzyme that turns it into testosterone, and then sometimes it turns it back. And how is that steady state between estrogen and testosterone in a woman's body? Well, that depends on her insulin resistance, and that metabolic health is like the first 10 things we want to take care of. If you're trying to decide if estrogen and testosterone belong in a woman's body, I first want you to tell me how many scoops of insulin leave your pancreas and flood throughout your body, because they really mess up all the hormones that we're trying to put in your body to get to the end organ. And by end organ, I mean your brain. I mean, yes, ovaries and bones, they're not insignificant, but my goodness, what it does to their brain. And it can't get there when you flood the body with estrogen. with insulin. Okay, we got a couple questions left here. L. Clark says, please elaborate on producing ketones 2 to 3 sessions per week means in regards to the statement. Okay, great. Really good question. So again, I teach the ketogenic diet. I know what it looks like to be in real life. And I have a support group every Tuesday morning where real people show up. They talk about the real journey of what does it look like to be on a long-standing ketogenic diet. I have them checking numbers first thing in the morning. What is your morning fasting glucose and your morning fasting ketones? My superstars, the patients who've been coming for a couple of years, they've really figured out how to take the 7 pillars of life and really not overeat, not push their carbohydrates too high, and they have tamed their insulin production to healthy. What does that mean? That means that a couple of times a week, they wake up in the morning with ketones above 1. Now, they may have other days of the week where their ketones are 0.6, 0.7, maybe 0.8, but let's just say 0.6 or 0.7. I'd give them an edge of an accomplishment there. I want really robust ketones at least 3 mornings a week. So if that means that you have to do a 72-hour fast to get ketones back in circulation, that I see that all the time. I don't think of those as my superstars. They live a life where the amount of carbohydrates going in and the amount of food volume going in and the amount of fat that they are able to use to nourish their body, whether they're mobilizing their own fat or they're swallowing it, results in morning fasting ketones that are 0.8, 0.9, 1, 1.2. Again, they're a hearty response. And again, that's first thing in the morning. Another way to say this is that their Dr. Boz ratio is less than 80 3 times a week. 3 times a week. And again, that's first thing in the morning. What I see with that is they have not hijacked all their fat-based hormones. If there is a routine percolation of ketones that show up in their circulation, their bone densities are high, their vitamin D is not in the toilet. When I check their sex hormones, they're in the normal range. And that's because they haven't hijacked them from high insulin most days out of the month. You can't have ketones first thing in the morning 3 days a week if you're on, if there's way too much insulin around. And I mean, that's the real journey. I mean, they are some of my favorite people to just praise when they come to the Pin Chasers because it's hard to do that. I don't think you can do it without a community. I think people fall off the wagon and say, I'm good enough. But my goodness, do they have a great life with, brain, sex drive, ambition, energy, all of it when they land on that. Okay, last question, and it's by Wendy. Should postmenopausal women take estradiol and testosterone? Oh, I kind of almost touched on that, but I'll re-answer it one more time. Estradiol has been sitting on my desk for months. Can one start without the other? I would never start testosterone before estrogen. I would always start estradiol before testosterone. I would only even consider adding testosterone if the estradiol is being taken sublingually and she doesn't have a super high insulin state, meaning I can reverse a high insulin. I can get the estradiol in the woman. That's not the hard part. Put it under her tongue, give it to her every day. It's a 7-day dose that is what we calculate. Meaning hormones are best thought of as your weekly dose, not a daily dose. What's the weekly dose? And when estrogen isn't working right, it's almost always a metabolic problem that's underlying there. Their mitochondria is not as strong. They don't produce as much. They don't keep that fat in circulation for the hormone side of things as long as they should because the insulin's too high. And when we rein in that dysfunction, their body goes back to using these hormones just like they should have. So when I look at the use of testosterone, yes, I've had people have just a hijacked, like the enzyme that makes testosterone is broken. It's just not working. And yep, they feel a ton better on testosterone. But that's like 1 in 100 women. Most of them, once you get their metabolic health under control and you start them on estradiol, they love you for sure by week 4. The first couple of weeks can be a little shocking. All right, folks, I really, hopefully you can tell, loved this topic. I'm super excited for women to be able to have their doctors educated about this topic, but also to have the conversation with the next generation of young ladies who should not do this in secret, whispering to the doctors who are willing to talk about it. We will see you next week, everybody. I am signing off, and I would love to see folks that are coming to my town for Hack Your Health.